And then you're gonna feel some cold spray here. And then a little pinch. And then your toe's gonna feel a little bit full with this fluid that I'm injecting.
Okay.
And that'll last for 2 to 3 hours.
I'll lift over for my hip.
Okay, that's perfect.
I use that when I need it.
That's perfect. Yep, that'll work just fine.
In fact, that's what I took after I had my sinus surgery too.
Oh, really?
That was another fun one.
Yeah, that sounds
Especially
not
when you're
fun.
awake.
Okay, so you shouldn't feel really anything here. You're gonna hear some almost like celery breaking. Getting a good release there. Definitely a tight tendon, I'll say that. Okay. Didn't feel any of that? Okay, good.
Just a little scraping noise.
Yep, a little bit of breaking celery, huh? Yeah, that's a good release there. Yeah, I can already feel that one's going to straighten out a lot more than the other one. But that's okay. Do a decent view of that. Doing okay?
Yeah.
Good. Okay, excellent. Got one more to go and then we'll get you all wrapped up, okay?
Sounds good.
This is a tough one. There it went. Okay, very good. Of how to dress these. So, what we do, so this one you don't have to repeat, okay?
Okay.
So don't worry about this. You'll take this Band-Aid off in about 2 days.
Okay.
So I'm just going around the toe here. That actually helps a little bit with the splinting. Because if you imagine it wrapping around, it's actually gonna have a straightening effect a little bit on those toes, okay? So we're gonna do that to each one of these. And again, I put just a little bit of medication on there. It's called Iodosorb. It does a really good job of fighting infection. And so we're gonna have that on there for the next couple days. And then I'll show you how to splint. Wrapping up toes is always an adventure.
Oh yeah.
Okay, so now we'll just kind of do our straightening. So what you're gonna do is you're gonna anchor at the end of the toe like that, okay? So it's just on that bottom pad, okay? And then what I want you doing is pushing on that top joint there and then push up on the end of the toe. And then all you're doing is laying that Band-Aid on top like that and anchor it back at the base of the toe, okay? So you see how it kind of holds your toe up just a little bit. The goal here is to make it so that that tendon does not heal right back in the place that it was. Effectively allowing this toe to relax and straighten a little bit more. So yeah, push down like that. Anchor it on there, and then you can see how these toes are getting pulled up a little bit. And then we'll finish off with these ones.
So taking a shower, I probably should wear some plastic bags over my feet.
Actually, you can go ahead and shower, no problem. Okay, these band-aids will hold for even after a shower for maybe another day or two.
Okay.
And then I wouldn't soak the foot at all for probably the next 72 hours. Okay? So no hot tubs or pools or lakes or anything like that.
Those anyway.
Okay. So we're straightening that out. And there we have it.